Good afternoon, and thank you all for being here today on Tuesday, February 2nd, for our regular coronavirus update. Before I do anything else today, I do want to recognize the sacrifice and the service of Lieutenant Michael Boutte. I spoke yesterday afternoon with Sheriff Adam in Hancock County. We lost a brave man yesterday. We lost someone that has served on the Hancock County SO since 2013. He had done so with distinction, with honor. He was a good man. I can tell you just from seeing the social media post about Michael, the people in that community loved him. They loved him because of who he was. They loved him because he didn't just ride by in his cruiser and check things out. He got out and he talked to the people of Hancock County. Ely and I have been praying for his family. We've been praying for Sheriff Adam and the entire Hancock County family. I know it's difficult today, but we're going to keep him in our prayers, and we're going to honor his sacrifice by remembering and thanking every single man and woman in Mississippi who gets up and puts on the uniform to keep us safe. Michael will receive every honor that the state has to provide. That's in recognition of his exemplary life and of his service, and in recognition of the heroic work and courage of all of our law enforcement officers. Now today will be relatively quick. First, a major milestone. We have, as of yesterday, now surpassed 250,000 vaccinations in the state of Mississippi. We are operating at peak capacity, and we're working to get even more vaccine into our state so that we can get it out to our people. As you know, the state-run sites have an even more difficult logistical challenge this week when compared to last week and the week before that, because now we're not only providing first doses at our vaccination sites, we're now also providing second doses. And so whereas we had 30,000 first dose appointments the week of 1/18, for example, as we move into this week, we actually have 30,000 first dose appointments and approximately 18 to 19,000 second dose appointments. So it is possible that that's going to cause a little bit more of a challenge logistically and possibly even a little bit more of a delay at some of the sites. So I encourage everyone to be safe. We will work out these kinks as we get there, but moving from 30,000 shots in arms to approximately 49,000 this week, which will move, by the way, to approximately 60,000 in the weeks ahead, is going to take a little bit of effort. In addition to that, I wanted you to know that earlier this morning, much as we had done repeatedly with the Trump administration, we did sit in on a call with many of the leaders of the coronavirus effort at President Biden's White House, including Jeff Zients, who is the new COVID-19 coordinator. He is the individual who replaced Dr. Deborah Birx, as well as a large number of other administration officials, as well as and including many other governors who participated in the call. And the primary takeaway from that particular call is what we've been saying in Mississippi for quite some time, and that is we really need the administration to focus on the supply issues, focus on manufacturing of the vaccine, much more so than distribution of the vaccine. We've certainly made that very clear to the administration. They certainly have heard us, and we certainly appreciate that. With respect to that, they do anticipate increasing supply a little bit next week. They have made the decision that they're going to partner in an additional federal pharmacy program, which they say is aimed at fighting racial disparities. And so I'm hopeful that they are correct in their efforts. I will tell you that I am somewhat concerned about those efforts because while it's probably true in Washington, D.C. or in New York City that you can walk a block in either direction and run into a Walgreens or run into a CVS or one of their partners is going to be Walmart, all three of which are great companies and typically do a great job. But in Mississippi, there aren't a lot of Walmarts in Issaquah County, and aren't a lot of Walmarts in very rural areas. And so they're tiptoeing into this federal pharmacy program, and we're certainly hopeful that it is helpful. They tell me that they are going to do approximately 10% of the total vaccine that the state gets next week will go into this program. And so we should get somewhere in the neighborhood of 45,000 doses, and I would expect that they will send approximately 10% of that, or 4,000 to 5,000 doses, to that federal pharmacy program. Again, I'm hopeful that it is helpful and it works in the distribution. It is going to be really our fifth distribution mechanism that has been implemented behind our state-run sites, partnering with the State Department of Health and our National Guard and MEMA, as well as the federal pharmacy program that has been set up for our long-term care facilities. In addition to that, we've got the distribution network through our hospitals throughout the state. And then the fourth, of course, is our distribution mechanism through our private clinics, many of which also are hospital affiliated. So we've got more, we'll receive more vaccine this week than we have the last several weeks, and that's going to allow us to continue to do the 30,000 doses at the state-run sites and ship approximately 20,000 first doses out to our partners throughout the state of Mississippi. So many of our partners, particularly our hospital systems and those private clinics, are getting more doses, and the only thing I will say with respect to that is just like we were several weeks ago, we are going to hold everyone accountable. If you get available shots, we want them to be in arms, because the sooner we can get more people vaccinated, the safer we can be in the state of Mississippi. And so I'm strongly encouraging our partners to make sure when you get those vaccines that you get them in arms, because future distribution will be dependent upon the ability to get shots in arms. And so with that, I am going to turn it over to Dr. Dobbs and let him give us an update on a situation where the numbers are still way too high across the board, but all the numbers that need to be going down are going down, and all the numbers that need to be going up are going up. So with that, Dr. Dobbs.
Yeah, thank you very much, Governor. Today we're reporting 825 new cases and sadly 76 additional deaths. We have reported a total of 276,531 total cases in Mississippi, associated with 6,132 deaths. If we look at the number of deaths that we had in December, it did exceed 1,000 of folks who died in December, and it's going to be well over 1,000 for the month of January. So a sobering reminder of the deadliness this virus, how deadly this virus can be. Although we're seeing a decline in cases, we still have a lot of stress within the hospital system. ICUs are showing some increased availability, but it's very tight, especially in certain areas. So we'll continue to watch that very closely. This COVID roller coaster we've been living on for a while, I don't think it's over. So please continue with the safety measures that we know are going to work, or we'll be back in the same boat we went through the holidays. And it's just the simple stuff. Please wear a mask when you're in public, and keep your social events small and outdoors. Social events, meals, where people get together from multiple households and share time without masks is where we see outbreaks. So please continue to be careful. If we're looking at the immunizations, we do think we're going to have a good week on our vaccinations. We're going to be doubling up first doses and second doses, and I have every confidence in our teams. They're going to perform wonderfully. So that'll be a new challenge, but I have every faith in everybody going forward. We are closely monitoring our external partners and are proud to see great progress and great efficiency more and more with our selected partners. So more vaccines will be available, and on our website we do have a posting of who those external partners are in your community, so you can see what options are going to be available outside of the drive-through clinics. And as you know, we did add 30,000 additional appointments today to the drive-through clinics, and they filled up by noon. So we know there's ongoing demand out there for those, without a doubt. And then we do have this new program that's a federal program that's going to supply pharmacies. Walmart specifically will be kicking off next week. We understand that approximately 30 different stores throughout the state with pharmacies will be activated. We do not have a final list of what those stores are, but we will let you know when they are on board. And we anticipate this first week about 6,200 doses being administered through this pharmacy program. So stay tuned. More information will be on the way soon. And the last thing I want to touch on real quickly is the variants. We are watching these mutational variants very closely. We do send off regular submissions to CDC to try to detect any of those. We have not to date seen any of the UK, South Africa, or Brazil strains in the state of Mississippi, but we will continue to monitor, and we are looking to add our own on-site capabilities of doing whole genome sequencing and aberrant strain detection here in our state public health lab. So we should have more real-time feedback on that going into the near future. And Governor, that's all I have. Thank you.
Thank you, Dr. Dobbs, as always, for your dedicated work over this past year. We will now turn the floor over to Mac, who is going to give us an update from the emergency management team.
Thank you, Governor. I want to announce today that go to Hurricane Zeta for just a few moments to let everyone know where we are. In the individual assistance program, direct funding to the families, we have reached a milestone there. We're at about $6.7 million that have gone out to families and housing assistance. We've got 5.7 million directly into the housing needs, and then the other needs assessment is about another 1 million. Something very significant as well is SBA has done over $10 million worth of loans. That's about $9 million for housing, and for those loans on those residences, as well as about almost $700,000 for businesses. And that can go for supplies that they might have lost, anything, lost wages, et cetera. So those are some significant numbers that the team continues to do out there in the disaster recovery centers, and make those things happen as the best we can for those individuals. We did get a report today from FEMA, as well as the governor knows about it, that we have been retroactively given 100% reimbursement on emergency measures for the COVID response since last January. That's a pretty significant mark for the state of Mississippi. It allows us to free up that 25% cost share that we were going to have to fund out of this response. And as we call it at MEMA, this is day 335 on this disaster. So I think it's March 335 of 2020 as we look at it. We continue to deliver supplies all around the state to those hospitals that need it, and also those long-term care facilities. Our stockpile right now is right at 60 days in every category that we've got. So we have not gone below that. We started to go below it in a couple of areas, and we beefed back up, but we continue to deliver all around the state. This week we broke 480,000 miles traveled in the state of Mississippi, delivering supplies to local counties, the long-term care facilities, and those that need personal protection equipment out there on the front line. Governor, that's all I have at this point.
Thank you, Mac. Appreciate you doing a fantastic job and jumping in here today. With that, we will turn it over to questions. Yes, sir.
Thank you, Governor. I'd like to go to you first, Dr. Dobbs. So these pharmacy partners, they are a big step. If I heard you correctly, you said 30 locations across the state. At the same time, 30 locations across 82 counties. It might be hard to make sure we're covering the ground evenly. So what's going into choosing these partners to make sure there might be a bus system that goes by them nearby, or or parking availability? And I have a follow-up after that when it comes to the pharmacies, please.
Yeah, so we're informed that some of the decision-making goes into geographic and racial disparities where they just select it. The initial list that they presented to us, they came up with the locations themselves and sort of matched in large measure places we would have chosen. So we think they did a pretty decent job. But of course, it's not going to cover all gaps. And so that's why we've got kind of multiple tools in the tool shed, right? So we'll continue to work with the Great Guard and Department of Health folks doing the drive-throughs. That's been a fantastic success. And the Walmarts will just complement some of the gaps, and then we'll use our other partners and find other innovative ways. So it's going to be a balance, and it's not going to be just a single solution.
Got it. Now my follow-up real quickly. If I heard you correctly, you said 6,200 doses. You know, in a way, I guess it's a bit of a good problem, but at the same time, we had a delivery of 30,000 this morning. You said they were gone by noon. 6,200 divided by 30, that's about no more than 207 doses per location. Are you concerned about the supply not meeting the demand, or how are you trying to approach that to make sure the full service is possible?
Oh, yeah. Well, certainly the supply is not going to meet the demand. It's just going to be a steady process. And in as many mechanisms with as much vaccine as possible, we'll just slowly take a bite out of the apple, just piece by piece. So I think we all need to understand that the supply is not going to meet the demand going forward. But, 250,000 of vaccines given, that's pretty good for a state the size of Mississippi. About 40% of people over 75 have received at least one dose. I mean, these are going to pay dividends down the line. And even though I know everyone wants a vaccine now and look forward to everybody getting it as soon as possible, we are gradually making great progress.
Real quickly, if I may, 6,200 in the first delivery to pharmacy partners, could that grow over time?
Our visibility on that's not clear, so I'd hate to speculate, but we think that's a floor.
Yes, sir.
Can you project how much longer will remain in this phase of 65 or older or medical vulnerable before opening the doorway for others to get the vaccine?
I would suggest that it is difficult to make that projection. What we do know that are facts is that to date we've had 131,000 Mississippians that are over the age of 65 that have been inoculated thus far. That's an incredibly large number, because we know that when you look at the total number of fatalities in our state, that somewhere in the neighborhood of 80% of those have come from that particular group of individuals, those over the age of 65. So if 80% of our deaths have come from that particular population, it stands to reason that if we can get a large majority of that population inoculated and vaccinated, then we can start seeing significant declines literally every day in total number of fatalities. And again, it also is true that when you look at those individuals over the age of 65, they are the ones that are most likely to be hospitalized and most likely to stay in the hospital for the longest period of time. And so again, when you everyone wants the goal to be for there to be zero virus in Mississippi, but as I've said since literally 350 days ago, complete elimination of the virus, while we can start having a conversation of that in several months, is still not a realistic goal in our state. Our state and every state in this country, and quite frankly, virtually every country around the world, the goal has to continue to be the same as it's always been, and that is, what can we do to protect the integrity of our healthcare system, to ensure that every single Mississippian that can get better with quality care gets that quality care. We've seen tremendous progress in terms of total hospitalizations. We peaked at about 1,450. Today we're down around approximately 900 Mississippians are hospitalized. It ticked just below 900, ticked just above. I haven't actually seen today's number. It was at 909 on yesterday, but approximately 900 Mississippians, so down almost 550 people in the hospital. Our total number of those individual Mississippians that are in ICU beds peaked right around 357. We were down to about 270, 275 over the weekend. So again, down about 25 or 30%. That obviously frees up some capacity in our hospitals, and so we're in much better shape there. We're continuing to see very high numbers in terms of fatalities, some of which are from death records, obviously. But the fatalities that we're seeing today are not from people who were tested positive yesterday. These are positive tests from 3 weeks ago, 4 weeks ago, 5 weeks ago, 6 weeks ago, when the numbers were very, very high. And so it certainly seems that with respect to those over the age of 65, we're making tremendous, tremendous progress. So what I would tell you is hopefully within the next couple of weeks, but a lot of it's going to depend on the combination of demand from those in the current individuals over the age of 65 and how much supply we can get from the federal government, because we are completely limited at this point to supply from the federal government, because that's the way in which they've chosen to supply us. Yes, sir.
Thank you, Governor. Speaking of that supply, so we know 30,000 today went to the drive-through site. You had mentioned the last time we met, you were hoping to get up to 43,000 in a single delivery to the state. Did we also get another 13,000 to go to our private clinics today, or where are we at with our partners at private clinics?
I wouldn't say today, but the combination of what we were able to order on Thursday night and then what we're ordering in the early part of this week will in fact be approximately 43,000. In addition to that, because as I've told everyone here, we're going to do everything we can to get as many shots in arms as possible. Dr. Dobbs and his team, after working with our entire group, was able to get an additional 8,000 doses transferred from our current federal pharmacy program, which was going to our long-term care facilities, into our general population program. So we really have about 51,000 total doses this week, about 21,000 of which will be distributed to our partners throughout Mississippi. And so that's a very positive development. Now, keep in mind, just because I want everybody to be clear, we're not transferring shots that we believe had any realistic chance of actually going in arms at our long-term care facilities. Remember, the way in which they allocated originally, this was a federal government decision, not ours, they took all of our long-term care facilities, about 450 of them, they took the total number of beds plus the total number of staff and assumed everybody was going to get the shots. Well, our long-term care facilities, the 450 of them, roughly 65, 70, 75% occupied. So there was an overage there, and right now I saw a stat earlier today that somewhere in the neighborhood of 62% of long-term care facilities staff are not taking the first dose. We hope that number declines over time, but the combination of those two things lead me to believe that we are going to have even more potential that we can transfer from that program, but we're working on that on a weekly basis, shall we say.
So just to make sure I understood you, if not today, you're saying another 21,000 doses are on the way to these private clinics, and can you tell me how you're deciding where they go? Because Hinds County has said they are experiencing a shortage.
Well, I would suggest to you that every county, if they were honest, is experiencing a shortage. Demand exceeds supply. Those 21,000 are going to be transferred out to our partners. There will not be appointments available on the website, as it were, for those 21,000. We are depending upon our hospital partners as well as our private clinic partners, many of whom have mentioned to y'all probably over time that they wanted more vaccine. Well, they're getting more vaccine, and I'm very hopeful that they will get them in arms in the next 4 or 5 days, such that next week when we can order more vaccine, that we have a reason to send out more to them, because we need those partners to continue to step up. We saw significantly better numbers in the third and fourth week of January than we saw in the third or fourth week of December, and we're hopeful that that will continue. But there needs to be a sense of urgency by all of us to get shots in arms. We have the capacity, we believe, right now at our state-run sites to do 30,000 first doses and to handle the logistics of doing 30,000 second doses per week, and that's looking at both Pfizer and Moderna, so that whomever shows up can get the dose that is appropriate for them. Should we have a difficult time getting these 21,000 doses in arms this week, we're going to look to find other ways to get them in arms, because our goal ultimately in the month of February is to significantly increase total number of doses and hopefully get to closer to 100,000 doses per week in arms. And that's first and second doses. Yes, sir.
Have we done away with the phase program that we had started at the beginning? In other words, I'm asked, God, what's the next phase of people who will be next in line to get shots? And I spoke briefly with Dr. Dobbs about this, and I'm just trying to get some feel. Do we know who's going to be next in line, or is that still kind of a fluid thing?
Well, I think it's somewhat fluid in that we made the decision in early January that government officials across the nation were spending way too much time thinking about and talking about and debating and discussing who should and who should not get the vaccine. And we tried to speed things up by saying, we know that those most vulnerable are those over the age of 65. Let's open it up to them. And we did it in a phased approach. We did 75s, I think, on a Tuesday of one week, and then we did 65s on the Wednesday, perhaps, of the following week, and I may be off a day or so. There is no doubt that our, in my view, and again, we'll ultimately jointly make this decision, but in my view, our teachers, our first responders would be next up on the list. They certainly, we want to protect them as soon as we possibly can. But the issue we have now, and it's better than the alternative, but the issue we have now is we simply have a scenario in which demand far exceeds supply. We have, what that means is a lot more Mississippians want to get the vaccine than we have shots available on a weekly basis. If we had 1 million first doses that we could get this week, we may not could physically get them in arms, but we could definitely open things up considerably. And so we think that we're probably in the neighborhood, Dr. Dobbs may have updated numbers, but we think we're somewhere in the neighborhood of 40% of those over the age of 75 that are eligible to get the vaccine. We know 100% are not going to get it, but 40% of those over the age of 75 have gotten vaccinated. Somewhere just shy of a third, maybe just shy of 30%, in the 30% range of those over 65 have gotten it. And so there's clearly a lot of people left in that category. But what we don't know, which makes it impossible to speculate, is what percentage of 65-year-olds and above are actually going to take the vaccine. We don't know that. We know it's a lot more than what we currently have. We know it's a lot more than 40% of those over 75 and a lot more than a third of those over 65 because appointments are going very, very fast. But if we're doing 30,000 appointments this week of first doses, we think there's at least an additional 20,000 first doses from this week's order, and probably another 10 to 15,000 that came in last week and the weeks before that just need to be put in arms. And so we're not where we need to be, but we've certainly made real progress. Yes.
Nick Juden with Mississippi Free Press has a question.
Hi, thank you. So we've heard a lot about vaccine disparity, both racial and economic, as the rollout has continued. As our scheduled allocations increase, why not take a portion of the extra and reserve it for less vaccinated populations who might not be as plugged into the website's sign-up method? And I will have a quick follow-up for Dr. Dobbs.
We do that.
Yeah, that's a good question. I mean, what we're doing is we are trying to make sure that with the extra vaccine, we are accounting for those challenges, whether, phone call, internet, that sort of stuff. So, early on, we decided that community health centers and other clinics that had good outreach would be, partners that we'd work with, and we are, and we'll expand that going into the next weeks. But we're also seeing that the other innovative approaches might be worthwhile. I've had several physician groups approach me about doing on-site clinics in areas where vaccines are not available. And I think that's going to be an exciting thing going forward. I've actually had probably 3 or 4 this past day or two. And that's perfectly okay. We'll try to get them vaccines so they can get to those locations. And, yesterday we did Black Pastors at New Hope Baptist Church, trying to help get some folks vaccinated and to get the word out. So I think we're going to be progressively addressing the trust issue along with the access issue. There's going to be more than one answer. We're probably going to try to adapt to some more aggressive offerings ourselves as we go forward. But this is a partnership with the communities, and we've got some good partners, so we're going to continue to grow that.
Right, and actually, right along that idea, beyond that, how many FQHCs have requested and received the vaccine? And if you could just go into a little bit more detail about what you're doing to push those numbers up. And additionally, are we expecting the newer vaccines, Johnson & Johnson, Novavax, these single-shot, more easily stored vaccines, are those going to focus on areas where it's more difficult to get vaccine to there and delivered?
Yeah, no, that's a good question. It's been a dozen or more of our community health center partners, but they have multiple locations. And where we've seen, kind of like with other clinics, we want to work with folks who are going to be effective. I can tell you that early on, Jackson Hines, Coastal, very effective. Other partners who are just getting started are going to do very well also. So we'll continue. We basically are working with everyone who wants vaccine in the community health center world. We'll work with them. And if they can prove that they're able to get it done, because some of them are off to a slow start, they need a little help. So we don't want to not use vaccine efficiently. As we look at the other other vaccines available, there are going to be different decisions we have to make because we're going to see variable efficacy with the Johnson & Johnson, AstraZeneca vaccines. And so there'll be some patient choice issues at play. So we'll be thinking about that. We certainly don't want people in disparity situations thinking that they're getting the less good vaccine, right? Even though it looks pretty good, and if we had gotten this back in December, we would have been doing cartwheels. But now that we have a 95% sort of standard, 66% to 85% for people for serious illness, it's great. But we need to be conscientious, thinking that people can choose it because they want it, not because it's their only choice.
Hunter Dawkins with the Gazebo Gazette has a question.
Thank you, Bailey. Thank you, Governor. This question is for either Governor Reeves or Dr. Dobbs, and I do have a follow-up after that question is done. The question would be, is there any way, and I know there's not a specific outbreak of it yet, but is there any way to keep track of the variant once it passes into this? Is there any way for the health department to keep track of a variant of COVID too as well? And again, I have a follow-up after you're done.
So we are doing surveillance for the variants, and we haven't seen it yet. When we do see variants, and I think that we will at some point see some of these concerning variants, we will plan to do extensive testing around as an outbreak sort of investigation, and specialized quarantine isolation sort of efforts, and having on-site whole genome sequencing capabilities will help us expand that also. So yes, there is a way to do that. Does that mean we're going to be capturing all of it that's in the community? Absolutely not. There will be variants that in the future will be circulating that we're unaware of. And the takeaway on that is, I think, just to remember to do the safety things. The same stuff that's going to work for the UK strain is the same stuff that's going to work. It's just more contagious. So you got to be a little bit more careful.
The follow-up, Dr. Dobbs or Governor, the state legislatures during the process of developing something for the Initiative 65, my question to either one of you would be, is the state health department set up to handle this program with whoever knows what might happen with it?
Well, I can tell you the version of the bill that I recently read actually has a lot more prominent role for other state agencies in the Department of Health, so it actually would probably be a lot easier than Initiative 65. But on the Initiative 65 front, we plan to meet the constitutional deadlines. But that's going to be a while. It's going to be licenses and cards going into next summer. It doesn't mean people are going to have access to medical cannabis at that time, but we have every intention on meeting our obligations.
Yes, sir.
Thank you, Dr. Dobbs. I'd like to go back to the pharmacies if I could. So you said we're gonna first try to get 30 locations across the state. Is it just CVS, Walgreens, and Walmart, or have you been in contact with family pharmacies? And would it be you sort of coordinating how their sites would work, or is it up to them with that?
There are 2 selected pharmacy groups for the federal program, and it's only Walmart. So only Walmart is going to be kicking in next week. And then they've also got a consortium of independent pharmacies that are the select partners. That group has not started operations yet as far as the federal partnership goes. CVS and Walgreens are not part of this community operation right now, just Walmart.
And do you have a time frame again on when these pharmacy locations will be up and running for vaccine sites?
We think February 12th.
February 4th?
12th.
February 12th.
Yes, sir. But stay tuned, please.
Keisha Rowe, Learning Library, has a question.
Thank you, Bailey. Thank you, Governor. The first question that I have is actually for either Governor Reeves or Dr. Dobbs, kind of a little bit of a point of clarification. I know we said that this week there were about 43,000 doses that have gone out, and I'm just clarifying that there was 45 that might be going out next week. Is that true? And then what is the kind of the rough general timeline when we might be able to hit that goal of 60,000 if there's one available? And I do have a follow-up.
Yeah, so the 43,000 number is correct and verified and ordered or will be ordered early this week. The 45,000 number is the visibility that we get on a weekly basis from HHS. And so this is what we anticipate our allocation to be next week. We can confirm definitively on Thursday night because that's when Dr. Byers and his team can go into the system and actually order it. But we believe it to be 45. We're in week 8 or 9 or 10. What they tell us on Tuesday so far has been basically exactly right. And so we expect it to be 45 next week. But again, that will be verified and confirmed Thursday evening.
And I think Keisha had a follow-up too.
Yeah, this one is specifically for Governor Reeves, and I apologize if something has been sent out about this and I just haven't received it, but I know the current executive order that was issued back in January for the 75 Mississippi counties is actually set to expire tomorrow at 5 p.m. Are there any plans to extend that?
Yes, we do. We plan to extend it sometime tomorrow. Our expectation is that it will be very similar, if not the same. Just a simple extension beyond tomorrow's deadline, probably through the month of February, but we're finalizing those details. Again, what we are seeing in terms of total number of cases, we've actually had less than 4,000 cases over the last 4 days. Again, less than 1,000 cases per day, which had we had that last March, we would have been blown away at how big the number is. When you compare it, as everything in life is relative, when you compare it to where we were basically the entire month of December and virtually the entire month of January, that's a fairly significant decline. In some instances, that 4-day average is about half of where the 7-day average was most of December and most of January. So what that tells me is that more and more Mississippians are doing the little things, the combination. And by the way, I am a huge proponent of the vaccine, and I am strongly encouraging every single Mississippian to get the vaccine. And I think it is the single most important piece to us seeing that light at the end of the tunnel and actually getting through the tunnel. But it, like everything else with this pandemic, is it is not the only piece of the solution. It's part of the solution, and it's the biggest part of the solution. But because we have supply issues, we still need to be wearing masks in public. We still need to be staying socially distanced. We still need to be keeping our groups relatively small. Those are all still important, and we do intend to extend that most likely for another month.
I don't know if you know the answer to this one or not. Handicapped people, homebound people who maybe can't get out of the car, get to pharmacies. Is there a plan in place for them to get a shot? Or are we that further down the line?
Yeah, that's something we've been thinking about and have started to work on. The challenge is, if you think about it, is each vaccine comes in a dose unit of 10 or 5. And if you're not careful about it, you're going to waste the majority of it coming and going. So there are some early planning on how to make that work out. So, but certainly if you're an aide or something like that, you're a healthcare worker, so get vaccinated yourself. And please, but if, as we expand to clinics too, I mean, even most of these folks do go to medical clinics at some point, that will also be an option.
Bobby Harrison has a question.
Governor, couple of things, just a point of clarification. You said teachers and first responders would be next in line. You don't know when they will be. It's too early to say when they might be. And also, just am I correct in that interpretation of what you said? And second, what do you think of the Medicaid Commission bill?
What was the second question, Bobby?
The Medicaid Commission bill to establish a Medicaid Commission in place of the leaving the Medicaid under your office.
Okay, thank you for those questions. With respect to the most likely next groups, once we get the most vulnerable, those over the age of 65 and those who have pre-existing conditions that put them in a scenario in which they are at the highest risk of hospitalizations and very, very, very poor outcomes. I do believe that our teachers and our first responders are currently slated to go next. With respect to the Medicaid Commission bill, I'm not all that familiar with it. As you know, there are approximately 3,000 bills that are filed each year in the Mississippi legislature. Today's a big deadline day. It's the first deadline day. I have a good team at the Capitol that is working on that, and I'm sure we'll sit down and talk about those bills that have survived thus far. But again, just to be perfectly honest with you, my team is monitoring it, but I'm spending an awful lot of my time right now focused on dealing with this emergency.
Jerry Mitchell has a question.
Thank you, Governor and Ben. A question and follow-up. I know that Oklahoma, Missouri ended up passing Medicaid expansion during the pandemic, and I know you've made clear that you obviously oppose any kind of Medicaid expansion because of the cost to the taxpayers. I think you estimated about $220 million, if I recall correctly. And now the Mississippi Hospital Association has basically proposed taking that $220 million on, saying it would basically be covered by both them and premiums, and which would, at least in their view, cost taxpayers nothing. And I wondered what you thought of that idea, if you support it or not, or why.
I will tell you that I have not seen their most recent proposal. I will tell you that if an entity is providing through a tax a match, first of all, it's got to be approved by the federal government, and it's got to be approved by CMS. And secondly, somebody's going to pay that. Most of the hospitals in Mississippi, not all, but most of them are nonprofit hospitals, And so the way in which that tends to occur is, while it may not come directly from taxpayers, additional money comes from either those who are privately insured, most probably, or for those who are paying cash. And so I am not for additional Medicaid expansion in Mississippi. I have not seen the specific proposal, so I can't speak to that. But I'll certainly, should it get significant legs within the legislature, I'll be happy to take a look at it. Yes, sir.
Thank you, Governor. Just as a quick refresher, I know you mentioned it a little bit, but it's been a while. So in these executive orders, talking about every daily routines revolving around the coronavirus and going out in public safety, what would be in these executive orders that people need to keep a reminder on, whether it's group gatherings, mask wearing, restaurant capacity, etc.
Yeah, for those counties that fit into those counties that have additional restrictions. For the counties that don't, those who have less than 200 cases over the last 2 weeks, or for those counties, there are very few restrictions in place. There are some restrictions on times for certain bars, and particularly restaurant bars, etc. We're looking at that. But for those additional counties, there are additional restrictions in terms of total number of people that can gather. There are a requirement of wearing masks when in public indoors, which we think is a good idea. Whether there's an executive order or not, the vast majority of Mississippians, as I travel, are protecting themselves by doing that. And so those are the primary areas: a requirement to wear a mask when indoors if you're in one of those affected counties, and tighter restrictions on the total number of people that can gather.
Which is 10 indoors or
10 indoors, 100 outdoors, I believe. Yes.
Alex Frazier with Mississippi Debate has a question.
Hey, I had a couple quick questions about the possibility of expanding drive-through locations. So just one, I guess, is that being considered? Are you determining new locations to consider, and then if there's a kind of a timeline for that happening?
Yeah, well, thank you. That's a great question, one that we have a lot of conversation about every week. I'll just tell you, our limiting factor on drive-through locations is number of qualified personnel that can actually administer the shot is a limiting factor. Each one of these locations, Mac, you may know the exact numbers. How many National Guard members do we have roughly at each site?
We've got roughly about 25, which totals up to about 1,100 of my force that's out there doing.
So we have
the whole mission.
1,100 members of the Mississippi National Guard that are currently manning these sites, and obviously it's about 25 per site. So another limiting factor is the total number of members of the Mississippi National Guard that we have dedicated to this particular effort. I will tell you that Mississippi currently, I believe, has more National Guardsmen dedicated to the COVID fight than any other state. We also have more National Guard members per capita than any other state. But we've leaned in very heavily in the use of our Guard. But that is a limiting factor. And so what we have said repeatedly to communities throughout the state is, if you are interested in doing drive-through sites, we are very interested in trying to help you find ways to supply it through additional vaccines, but we need you to bring resources to the table such that you have, for instance, in several counties, we've got one in Warren County, we've got one in Lawrence County that are drive-through sites in which the local healthcare facilities are partnering to help provide certain aspects of it. And if the county really is interested in doing a drive-through site, we are very, very interested in partnering, which means we provide the vaccines, perhaps particularly as supply increases, and you provide the resources. The 15 sites that are open every day, which really is about 19 to 20 total sites, some of them are not open every day, but we have 15 open each day, spread throughout the state, are specifically designed to be high throughput sites. It was originally put in place so that we could catch up, because as you'll recall, in early January, we were behind on total number of vaccinations in arms. We've been able to catch up such that we are now putting, at least until this week, and we'll see how this week goes, but every single vaccination dose that we get, we are putting them in arms on a weekly basis. And so, again, we hope to continue to spread out through the distribution mechanism. We are definitely making the decision that if you, and I can see every single week, total number of vaccines that are put in arms at our state-run sites, and we look at it every single week. Based upon the eligible population in each of those districts, we are basically very, very near where we would expect us to be in terms of geographic distribution and geographic diversification at our state-run sites. And so, long story short, we're interested in more sites. We are limited by a number of factors: total number of trained personnel to actually put shots in arms, total number of personnel that are on orders that have these sites. We're limited by supply to a certain extent, and then we're also limited by location, because you can't just take a little small building in the middle of town and have a drive-through site with 1,000 people coming through on a daily basis. And so each site takes a lot of effort to make sure that they are open, and that's the reason you see them at places like the Convention Center, for instance, in Harrison County. It's the reason you see them at places like Trustmark Park in Rankin County, at places like Smithville Stadium with a very large parking lot in Hinds County. It takes that kind of space to handle the logistics. Yes?
Bryce Harris with NBC has a question.
Good afternoon, everyone. What I wanted to ask about was, it's been discussed today about the limited supply of vaccines the state has to work with in terms of thinking of providing extra doses to community partners. I did want to ask, however, what is the timeline the state is looking at to push extra doses to community partners? There are states and cities that have already been aggressive about targeting vulnerable zip codes with allocations, whereas in Mississippi, we have a number of counties that rank very high on the CDC's social vulnerability index. I'm thinking of Claiborne, I'm thinking of Issaquena, that don't currently have a site that's offering vaccinations this week. And I do have a follow-up about numbers.
Yeah, so we do look at those counties, and we are trying to cultivate good partnerships. Like Wilkinson County was a location that was kind of on the lower side, and we've had a really good, successful partnership with Field Memorial down there, and they want more vaccine, and we'll try to get them more. There's a lot of counties. We do have some access issues across state anyway, just for healthcare, and that's going to be another challenge. Kemper County, for instance, Noxubee, those are places that we're finding partners. Where we have community health center partners, we've tried to really work with those because we know they work with disparity populations. So I would say quite the contrary, we have been aggressively trying to address these disparity zip codes. But there are also some existing sort of healthcare infrastructure challenges in some places, especially like Issaquena and Claiborne. We do have some partners there too. Alcorn State actually has just become a registered site for vaccine as well. So yeah, and if you look at the amount of vaccine we've actually given in the state, because we started off with hospitals early on, the majority of vaccine has actually gone to partners. We've been more efficient in some respects, I think, with the drive-thrus just because it's an efficient model, but our partners have been great, and now we're trying to make sure, and have been since the beginning, making sure that our disparity communities did have access to vaccine. And if you look at the variability by county, there is some significant variability, but a lot of the variability is less extreme than it might be seen elsewhere.
Okay, and just to clarify before my follow-up, I just want to make sure Mississippi has been using a metric system, let's say like the CDC Vulnerability Index or some other type of system to allocate extra doses based on high risk. Tennessee, for example, I know has identified counties in particular to receive extra doses on top of their population proportionality. And I just wasn't clear that that was a similar system was happening in Mississippi, but if it is, I guess an overview would be appreciated. And the question about numbers was just asking what was the amount of first doses allocated to hospitals and community partners last week. You provided those numbers for this week, and I just wanted that for a comparison point. Thank you.
Yeah. So what we've used as a metric for determining where we need to have excess focus, it's going to be who's eligible and the percent of eligible population that have been able to get vaccine within a population based on our eligibility criteria of 65 and older or medically vulnerable. And so we have that for every single county and every district. And another part of that is going to be a breakdown by race and ethnicity. And so that's what we're using to try to make sure that we steer additional vaccine to those areas. And we have team meetings multiple times a week looking at that, trying to see what we can do. Health disparities is not just something that we can erase. It's a challenge, and it goes deeper than just dedicating vaccine to a location. As you see in the paper, even sometimes when you put vaccine in disparity communities, people who have resources use those appointments too. So it is a deep challenge. The weekend before, I think we did about 12,000 doses to partners, and the week before that, I think it was about 6,000, based on availability. So that's just off the top of my head. I've got spreadsheets, can give more detailed numbers later. Thank you.
I would just point out that what we're seeing in terms of total number of vaccinations in our African American population, for example, also it's not just a supply issue in those areas. There's also, and this is not unique to Mississippi, by the way, so I want to be clear, this is being seen throughout the country. There's more of a natural skepticism to get the vaccine amongst our African American population, and that's true across the country. I'll give you some examples. The fact of the matter is that if you look at a state like North Carolina, I saw a recent report that was done, 22% of North Carolina's population is African American, 11% of the doses have gone to African Americans in their state. That's a state run with a Democrat governor. Maryland, a Republican governor. Again, 30% of the population African Americans, only 16% of the total inoculations have gone in African Americans. You look at New Jersey, again, Maryland run by a Republican governor, New Jersey run by a Democrat governor. 15% of the total population is African Americans. Only 3% of the doses in New Jersey have gone into the arms of African Americans. In Mississippi, approximately 21% of those that we know that have actually identified as either white or African American, 21% of our doses have gone in the arms of African Americans. And so the fact is we have a natural skepticism amongst our African American population, and we've got to work to correct that, while at the same time recognizing that we also have certain comorbidities that are more prevalent in that population, and so we're not going to solve those overnight, and by determining where we ship vaccines, not going to solve a lot of those disparities. But we've got to continue to work towards it, and I think certainly Dr. Dobbs and his team working with us, we have made efforts to do so. Yes, sir.
Speaking of that, Governor, have you had any conversations with members of the Jackson City Council or the mayor's office with Jackson to try to see if people who might be skeptical, if they see leaders that they may agree with, or community leaders that they look up to in certain ways? You know, have you had conversations about opening up more for them to get it, or maybe locations like the Jackson Medical Mall that the buses could easily take them to instead of them driving?
Well, we've certainly had a lot of conversations over the last several weeks. I've had very detailed and very good conversations with the Legislative Black Caucus. I've had very quality conversations with some that I would consider leaders in the African American community, both in terms of pastors as well as other leaders who shall remain nameless at this time. I know Dr. Dobbs and his team have done the same. Including doing press availability with some prominent African-American physicians and I think some African-American pastors as well in the last few days. And so there is a concerted effort, and I'm proud of that effort. I'm proud that we are working to do everything we can to make it as readily available as possible for all Mississippians. And I think that's what we're going to continue to do. There's no doubt. I mean, you know, there seems to be an assumption that that the only way to increase the number of African Americans who are receiving the virus is to open new locations or do other things. We got to continue to communicate, and we got to continue to work at it. But I'm proud of the fact that we're seeing. We're literally operating at max capacity in Mississippi, and every single shot we're getting on a weekly basis, we're getting in arms, and we are certainly not perfect, but we're making progress every day. Yes.
Michael Boudreaux with MPB has a question.
Yes, and this pertains to some of the conversation that's occurring right now. The Department of Health, along with the State Association, had an event yesterday with prominent faith leaders from Mississippi's black communities about the importance of getting the vaccine. And there were the conversations a week and a half ago about where to, or opening one in Hinds County to serve that community. The decision was made to put it at Smithville Stadium, which is adjacent to probably one of the most affluent neighborhoods in all of Hinds County. And so I just wanted to kind of ask Governor, you and Dr. Dobbs, what were the determining factors in choosing someplace like Smith Wills, which is less than 8 miles away from Trustmark Park, where there is already an existing drive-thru facility, versus somewhere like Metro Park Mall, which, just from my determination, listening to some of the factors you considered, have the large parking lot and the accessibility measures that are needed to create a large flow-through facility. What were the determining factors on making Smith Wills the Hinds County designated location in South or West Jackson that would serve that underserved community?
And our logistics team did look at Metro Center Mall and other places, and it's done in concert with the local folks. And Smith Wills was felt to be the best location for the operation to work successfully. Now, understanding, someone had mentioned something about the medical mall, but we also know that UMC is going to start doing a walk-through clinic at the medical mall. So there's multiple things going on. I mean, using the lens of the drive-throughs as the totality of the effort is I think is a little bit incomplete. I mean, there's a lot more going on, and if you look at Jackson Hinds and where it is in West Jackson, and looking at adding something to the medical mall and bringing on more aggressive partnerships with Central Mississippi and other folks, it does tend to round out a little bit more clearly. So it was a logistics operational decision based on the best place to make it happen and the decisions of the local folks too. So you know, Jim Craig, he's our main logistics guy, and worked closely with all the teams to make sure that it was the best place for it. But there will be multiple places to get it. Don't worry.
And if you know someone that wants to partner with us to open a site, whether it be at the Jackson Medical Mall or the Metro Center Mall, or you name the location, we would love to continue to add drive-through sites where those in local governments will help us provide resources. because that is a limiting factor altogether. The biggest limiting factor, of course, is total number of vaccines and the lack of supply that we currently have. Yes, sir.
Thanks. Real quick, Dr. Dobbs, can you give a time frame? Have you been in contact with UMMC when they might open up this walkthrough clinic at the Jackson Medical Mall and how that would work?
They're still in operational mode, and they're probably on the TV, super excited that I've kind of given them so much pressure. But yeah, but it's on the way. It's on the way. So stay tuned.
Yes.
Nick Juden has another question.
Great.
Yes, Governor Reeves, have you spoken to anyone in the city of Jackson, government, anyone on the COVID task force? Are there plans to work with the capital city to expand access in this area?
There are plans to work with any and everyone that is willing to work with us. We'd love to have those conversations, and we'll be happy to do so. I have spoken to a large number of folks and have pretty regular communications with city leaders in Jackson and throughout the state.
And we are meeting with the mayor's team and physicians who are aligned, who are on his task force on this very issue. We're all doing 1,000 different things in partnership, so there are active conversations, yes.
All right. Well, look, thank you all for being here today. We always appreciate you. We're continuing to make progress. I appreciate the hard work of Mississippians throughout. Y'all stay safe out there, and God bless.